So I want to start with just saying a few words,
Sure.
get us started. Last flu season was a little different. We were all wearing masks everywhere in public. Many of us were working from home. All kinds of events and activities were canceled. And when we were together, we were practicing social distancing. For that reason, our flu numbers last year were historically low. While we're still taking some of those COVID prevention measures this year, we're masking currently, we do expect more flu activity in Rhode Island to occur this flu season because our mitigation steps are somewhat different than what they were last year. And that's why it's important to know that the flu vaccine is your best protection against the flu. Vaccines work. It's fast, it's easy, and it's free. You don't need to get insurance. You don't need insurance to get your flu shot. And flu shots are available in every community in Rhode Island. Everyone 6 months of age and older should get a flu shot every year, and it's especially important for certain people to get vaccinated. Those certain people include pregnant women, people 65 and older, younger children, people with chronic medical conditions, healthcare workers, and people who live with or care for those who are at high risk of flu-related complications. In Rhode Island, there are hundreds of places where you can get a flu shot throughout Rhode Island. You can come to a pharmacy like we're doing today. Many doctors and other healthcare providers will give you a flu shot at an annual wellness exam. That's how I just got my flu shot yesterday. And we have school clinics that run throughout Rhode Island. These clinics are open to students and staff, and many of them function as community clinics as well and are open to everyone. The evening clinics in particular are the ones that tend to be open to the community. So please take advantage of that. For more information, go to health.ri.gov/flu. With that, I'll stop and we can take any questions.
Well, nationally, numbers are down about 40% as far as getting the flu shot. How do you convince people to A, get the flu shot, and B, that it's going to be somewhat of a match since we had very few flu cases last year?
Well, we can't overestimate the challenges that can come with the respiratory viruses such as flu, similar to COVID. And the fact that there is a tool, a protection that can be used for you, for your family members, for your loved ones, is something we want everyone to take advantage of. It matters in helping to make sure that you're kept safe and the ones around you, those who are infants, less than 6 months of age, for example, can be protected by you being able to get vaccinated. I wanted to also use that to talk about, oftentimes people say, how do we get the flu shot and a COVID shot at the same time? And it's possible to do. It's something we fully encourage. If that's more convenient for you, we want you to go for that. Many of the underlying health conditions that make someone more vulnerable to COVID-19 also is what makes them more vulnerable to the flu. The flu vaccine and the COVID-19 vaccine will both help keep you healthy as an individual and keep your family safe by helping prevent the spread of viruses, and is an important way to protect our healthcare system, helping to ensure that our hospitals have the capacity they need to be able to care for you, can be addressed by you doing the job of getting vaccinated. Our hospitals are seeing surges in patient volume every winter because of the flu. And this is during a time when the hospital and healthcare system nationally are already experiencing challenges. So getting a flu shot along with your COVID-19 vaccination, if you haven't already, are just one of the many ways you can help stay out of the hospital and keep your loved ones out of the hospital so that our hospitals are able to provide the high quality care they can for loved ones and anyone for heart attack or some other reason that doesn't have a vaccine to prevent against it.
Have we seen any cases of the flu so far? And when is usually peak season? And also talk about when the flu vaccine usually kicks in as an effective.
Yep, we can get you numbers on where we are. We are expecting to see higher numbers this year than the record low numbers last year. Our website and data team does a fantastic job at keeping that updated. So health.ri.gov/flu. We typically start to see the peak further on into the winter, late December into January. So getting vaccinated now is an effective way to help prevent against that. And it's out there. We're trying to make it as easy as possible. We're taking all of the great lessons learned from our COVID vaccination. We're doing great as a state. Let's keep that going with getting vaccinated against the flu as well.
Doctor, do you envision the way that each fall they roll out for people to get a flu shot, that the COVID will also probably be kind of rolled into that each fall, maybe once a year, people would get a COVID vaccine and their flu shot?
It's potential. We are working with our federal partners to better understand, but we are familiar and becoming familiar with the seasonality that we see with COVID-19 as it being similar to the other respiratory viruses that happen at this time. And so it being a norm for our healthcare workers to get vaccinated, our students to get vaccinated, any person who is working, or our seniors, our pregnant women, we want all of the individuals, particularly those at highest risk, to have access to the vaccine that's going to protect their lives and their loved ones as well.
Governor, I understand you've already gotten your flu shot?
Yes, I got my flu shot at Operation Stand Down on Johnston about 3 weeks ago, I think it was, yes.
And why is it we're here? Why are we doing this here?
We're doing this because it's a community, a small business, a pharmacy that provides services, and we want people to know that they can have access to their local pharmacy. A few weeks back, we were at a pharmacy on North Main Street, and making sure that people know that they have access. That's one of the most important things that we can tell people, is that there is accessibility in your community for a flu shot.
Do you have any political connection with former Treasurer Sullivan?
No, I knew him. I can't say I don't think that's the reason we're here, but I was noticing the pictures up there, so so I'm sure that his family's happy that that we're here, keeping people safe.
Lieutenant Governor, this place is kind of special. Thank you.
Thank you, Doctor. So, Steve, I do have a connection to this location. This is the neighborhood that I used to represent when I was in the Providence City Council. When I ran for office the first time, I lived just up the street. So I'm glad to be back in the neighborhood to show my neighbors and everyone in the state of Rhode Island the importance about getting their flu vaccine. So there's a political connection right there. So yo les quiero decir también en español que yo estoy contenta de regresar aquí al vecindario donde yo empecé mi carrera política, aquí en el vecindario en la farmacia de Anthony, que todos conocen, para decirles que es necesario que nos pongamos la vacuna en contra de la gripe. Es otro método como podemos evitar el enfermarnos, y también podemos evitar el hacer que nos enfermemos a un punto que llegamos al hospital y vamos a mantener los hospitales demasiado llenos de personas y no vamos a poder atender las emergencias. Así que vamos a ser preventivos, vamos a prevenir la gripe por mantenernos, por tomar nuestra vacuna de la gripe.
Governor, speaking of pharmacies, what's your initial reaction to former CVS executive Helena Foulkes entering the race for governor?
If we can just keep this flu related until we're done, we can make
Yeah,
a sidebar outside.
Quick question.
At this point in time, you know, people are going to enter the race, and when I'm ready to enter the race, I'll have comments on that.
Question for the doctor.
Usted necesita una máscara, Juan.
Right here.
Billy, I have an extra one.
This one right there.
Okay.
Juan Garcia has joined us. Go ahead, Juan.
Tengo una pregunta. Mucha gente inmigrante no se ha vacunado. Yo tengo mucha relación con ellos. El problema de ellos es que ellos trabajan de las 5 de la mañana a las 7 de la noche. Ya está cerrado todo lo que es vacunación. ¿Cómo ustedes, como en otros países, están haciendo como gente que va a vacunar a las casas? Porque es importante, porque esa gente tiene niños y esos niños se contaminan porque los padres no se han vacunado.
Okay.
Good question.
So that's a good question. So I'm going to translate for the doctor.
Yeah.
So Juan wants to know, there's a lot of individuals that have not gotten the vaccine because they work and the vaccines, the schedules, the pharmacy is closed already by the time they leave, they come home from work. So he wants to know if what is the state doing to help individuals in those cases.
Absolutely. When you go to our website, health.ri.gov/flu, you see the different flu clinics that are available, including the school clinics that are available for families and for after hours and weekends when needed. We have the information to be able to contact us to get further information about where you can go. Can call 401-222-5960. We have people there ready to help in English and Spanish. We want to make sure that the flu vaccine is free for everyone. No one has to pay out of pocket for a flu shot. However, if you have insurance, your insurance company may get charged a small administrative fee. But if you don't have insurance, definitely call 401-222-5960, and we can get you to a clinic where you can get vaccinated without having to worry about any fees and at a time that works best for you and for your working family.
I say, but why the people don't go in the houses? Because it's very important. Because the people, some people we have escaped, to go to the clinic. For different reasons, we have no paper or whatever, was in document. We have to escape. Why not have to make a team to go in a house? Try healing only. A lot of people is not vaccine because the people we working a lot. So in the morning, back in the night, why not you will make a team to go in the houses and apply the vaccine?
Yeah.
This is for safety in the community and the kids.
Yep. It's a great suggestion. It's an approach that we have applied for COVID-19 vaccine and having pop-up clinics in areas near homes. We want to ensure that documentation status does not impact at all getting a flu vaccine. We don't look at any of that. We welcome everyone to be involved, and that's why we're creative in having places like a pharmacy where you're more comfortable, or your school where you're more comfortable. And I love the suggestion what we did with COVID, figuring out other ways to incorporate it into clinics closer to people's homes so it's as accessible as possible.
Thank you.
Doctor, what are the concerns and options for people who have different particular needs? Do elderly people need a different vaccine? Are there trivalent, quadrivalent vaccines? Are there adjuvants? Are there egg allergies? I mean, what different considerations are there, and what should people do if they have different considerations or different needs?
Well, the first always, if you have a healthcare provider or primary care provider, that's your home base and the best place to get the information that you need about what's best for you. There are different types for seniors, high dose, and there's clear information about allergies and what to be aware of and when you can still go ahead and get vaccinated. But even if you don't have a healthcare provider, going to our website, health.ri.gov/flu, or calling the phone number allows you to go to one of the clinics that we have set up and you can get the information right then and there. We will walk you through each of the steps to help determine which vaccine is the best fit for you and what, if any, precautions. The majority of people can get vaccinated against the flu with no problems whatsoever.
And following up on the prior question, is the state making any specific outreach efforts towards subpopulations, the elderly, high-density communities, and so forth?
Absolutely. We're building on what we've learned through COVID and what we've done for years prior. We have a Vaccinate Before You Graduate program for our youth. We work closely with providers and senior centers about helping our seniors feel comfortable in getting vaccinated. The school clinics are open to communities in certain areas. Our municipal leaders have become critical partners with helping to ensure folks are vaccinated, and did a great job supporting our seniors in getting vaccinated against COVID. So we want to build on all of those successes and help make sure that, just like with COVID, with the flu vaccine, we are higher than 90% vaccinated across our population and can be confident that our most vulnerable are protected.
Can we take two more questions? I think that's all we have time for. Doctor, what were the flu vaccine rates in the last year during the pandemic and then maybe the year before that?
They were much lower last year, record lower rates. We can get the exact numbers for you. Our influenza-like illness surveillance program now is already up and running. We do that every single year, and we're so far seeing very low numbers, but we do expect it to pick up because we are still very early on in the flu season. It is why it's so important. This message is critical, that everyone has the opportunity to do something themselves to make a difference. Get vaccinated yourself. Get educated on when you do need to go to the emergency room and what those symptoms look like, because all of those steps can help ensure that our hospital systems have the capacity that they need to care for individuals who truly need that care. We want to help ensure everyone understands this message is about making sure that your loved ones can go to the hospital and get the high quality care they need for whatever it is, just because you and your loved ones have gotten vaccinated against the flu, against COVID, and any other vaccine preventable diseases that are out there.
And it's important to note the flu and COVID have very similar symptoms.
Absolutely, they do. They do. And all of them can be protected against with the vaccine. And with the vaccine, we've seen with COVID the same as with the flu vaccine. Even if you were to get the illness, it's significantly milder. These vaccines are extremely effective at keeping people out of the hospital and keeping you alive. And if you think about your loved ones, what's the most important thing you want for your loved ones? Anything you can to help them stay alive, thriving, and healthy. And we're here today to say vaccines against the flu and COVID-19 are the way to do that.